Good day to all of you. Welcome to the program agenda. I'm your host, Cito Beltran, thanking you for once again joining us today, November 24, 2022. It's a Thursday, and I am here in a bright, sunlit Lipa City for today's program. And thank you to PLDT for their ever-reliable internet connection. Because kahit mapabagyo ang Kuya Cito, mapalipa Batangas, mapakapitolyo Pasig, we stay connected to our audience. Thank you, PLDT. And of course, thank you to all of you who are subscribers of Cignal TV, viewers of One News PH, One News, and viewers on channels 8 and 250. Maraming salamat po. Let's start the day with our daily starter, and it goes like this. When prayer becomes your habit, miracles become your lifestyle. I repeat, when prayer becomes your habit, miracles become your lifestyle. Many people will only pray when they are in a bad situation, when they are under pressure or facing difficulty, and that's normal. That's human nature. But may I encourage all of you out there, make prayer a daily habit. And not just for religiosity, but because it really works. And may I add, because I recently came across this issue, when you pray, don't just pray for your needs, because that's a one-way street. Pray for those around you, even go as far as praying for our country, our leaders, and of course, those in your community, because when that happens, it all becomes just part of your lifestyle. And I myself, my wife, my daughter, our daughter, we try to do that as part of our lifestyle and the community that we belong in. Okay, so when prayer becomes your habit, miracles become your lifestyle. And now, let's go to the front page of the Philippine Star, where we will read up on the news, at least on the front page. And the headline goes, Government Considers Review of Philippine-United States Defense Pact. After 71 long years in existence, the Philippines and the United States we may soon come before each other on a table to discuss a revision of its defense pact, or our mutual defense agreement with the U.S. Because as our national security advisor shared in an interview with the chiefs on Cignal TV, that the Philippines has outgrown what it was 71 years ago. It has become more independent in its international relations and policy, and the growing concerns in the region requires that the review of the U.S.-Philippine Defense Treaty be done and come up with something that is addressing current and future concerns. Meanwhile, at the top of the front page, the header of the Philippine Star today, Cop gets life, 14 drug suspects torture and death. Okay. Jeffrey Perez, who held the rank of Police Officer 1, attends a Senate probe on September 2017. Okay, yan po, a file photo, has been sentenced to life in prison for the false arrest, planting of evidence, torture, and killing of drug suspect, and his accomplice was never sentenced, also a policeman, because the cop died in jail. So ayun po, for those of you who are wondering about justice in the Philippines, it happens. Justice is served, although it takes a while. Meanwhile, speaking of justice, wrong name, bantag, no show at preliminary probe. Okay. Suspended Bureau of Corrections Director General Gerald Bantag was a no-show at yesterday's preliminary investigations on the Percy Lapid June Villamor murder complaints. According to Bantag's lawyer, Rocky Balisong, the subpoena issued to him was for a different person because the name was wrong. Okay? Kasi nakalagay na family name Soriano. Yung pala, Kitaleg ang middle name pala ni General Bantag. So, ayun po. Okay, Director General Bantag. Okay, the big photo at the top of the front page of the Philippine Star is something that will make you cry. I'm talking about sako-sako ng sibuyas, sacks upon sacks of onions, medyo Bombay onions, hindi pa yan Bombay, Bombay onions in a stall in westbound Bulua, Cagayan de Oro City yesterday. The price of Bombay onion has risen to as high as 300 a kilo. Correction, okay? Last week pa, 400 pesos a kilo na yan in a leading supermarket as written by several columnists. So, merong onions, may red onions, some even claim they have seen the legendary white onions, pero red onions for 300, as the report goes, to 400 a kilo. Meanwhile, the Commission on Appointments has confirmed the appointment of former Justice Lucas Bersamin as the Executive Secretary of the BBM administration, and the appointment of Secretary Benjamin Jokno to the Department of Finance. Both of them were approved in yesterday's session of the Commission on Appointments, while the rest are still in la-la land waiting for the approval of the Senate. Meanwhile, President Marcos urges scientists stay in the Philippines and help the government. Speaking at an event, okay, the 2022 National Science and Technology Week in Pasay City, the president urged scientists to stay in the country as you pursue your career. We will continue to support you and continue to look to you to be active partners of the government. Sana, okay? And sana all. Kasi maraming mga scientists na nagsasabi, hindi na nga kami sinusuportahan, tawag pa sa amin mga witch doctor, okay? Or mad scientist. So, well, we will see what happens under the Bongbong administration. Meanwhile, center photo of the Philippine Star, very interesting, ladies and gentlemen, is a photo of Department of Trade and Industry Secretary Alfredo Pascual and Marikina Mayor Marcelino Teodoro and DTI Consumer Protection Group Head Ruth Castelo conducting their first market monitoring and inspection of weighing scales at the Marikina City Public Market. Now, why is this an interesting photo? Because clearly, Secretary Alfredo Pascual is now making his presence known in media and to the public because recently his name was also included in the fake news and the gossip attack as one of the cabinet members who was going to be replaced. So ayan, kumbaga nagpaparamdam na at nagpapakita na si Secretary Fred Pascual. Okay. Meanwhile, group marks 13 years since Maguindanao massacre. Okay. Yan po. Several groups yesterday marked the 13th anniversary of the Maguindanao massacre, where some people have been sentenced, some people are still wanted and have not been arrested, and some are still appealing their convictions. So feeling ng mga pamilya ng mga pinatay in Maguindanao that justice is taking forever to be served. So it will be up to Secretary Boying Remulla and the Supreme Court to do something about fast-tracking justice in the Philippines. Okay. Meanwhile, sad news, multiple people dead in a Walmart shooting in Virginia. That follows another shooting that happened a few days ago. All in America, ayan po, sila-sila na ang nagpapatayan sa United States of America. And on the bottom left side of the newspaper of the Philippine Star, we have a photo of various strategies, officials of corporations gathering together for the Pilipinas Conference 2022. And among them were senior executives. Hindi ko na po mababasa. Sobrang dami po nila, sobrang haba. Just please go read the newspaper today. Last but definitely not the least, Pope sacks Tagle, leadership of Caritas International. Mabigat yung headline, but let's qualify. Pope Francis has removed on Tuesday the entire leadership of Vatican-based Catholic charity network Caritas International, including its president, Cardinal Luis Antonio Tagle, and appointed a temporary administrator after outside external experts highlighted management and procedural deficiencies. Okay, walang illegal, walang immoral, kailangan lang iayos yung pamamalakad at pag-asikaso ng proseso. Okay, so I'm making that clear kasi baka mamaya nyo, there are people who will start talking about this and palaki na naman yan ng mga malisyosong Marites at Mariano sa lipunan. Okay, that's all we have for the news from the front page of the Philippine Star. Please go get your copy or read it online. Now, we're going to have an interesting interview. Someone I know personally, I've known her for several years, and someone who to me symbolizes professionalism, vision, and dedication to work. And she is also a good interview for those of you who may be interested in a career not just as a physician, but as an health executive, public health executive. Magpaturo tayo sa kanya, paano ba maging hospital director? Masaya ba? Gabi, roll out the Betamax.
Dr. Rica Lumague is the chief of the Rizal Medical Center. She also works at the hospital's Department of Health Rizal Cancer Registry. Aside from this, Lumague is also a consultant in surgery at Cardinal Santos Medical Center.
Good morning, Dr. Rica. Welcome to the program agenda.
Well, blessed Thursday morning, everyone. Thanks to you, Cito, and to your dynamic team for the gracious invitation to be part of your show today. Excited to chat with you, and mukhang fresh and green ang background mo, ha?
Medyo na pinagpala ng pamana ng tatay ko. Okay. Anyway, Dr. Rica, I'd like to start out with you as a physician because many Filipinas want to be doctors, but not a lot talk about a career as a public health executive. So let's start from the very beginning. Parang elementary,
Sure.
no? Ikaw ba, when you started, were you really planning to become a doctor? Because it's not an easy choice and it's not a cheap choice, becoming a physician.
Well, to the surprise of many, at the age of 7, I decided I wanted to be a surgeon. Okay ba yun?
Wow. Ang bigat mo. Surgeon ka agad.
Yes.
Yung iba, play doctor lang. Let's play doctor. Ikaw, I want to be a surgeon. 7 years old ka pa lang.
Yes. Well, for one thing, in our house in Santa Mesa, my mom opened our house for those who came for board and lodging. And one of those who stayed with us was my cousin.
Mhm.
And he was a top-notch medical student and pursued neurosurgery. So at that time, I would go to his room, look at his books, and I was really very intrigued and interested in becoming a neurosurgeon at the age of 7.
Mhm.
Yun,
Okay.
that's how it started. Yeah.
Okay, now, how was it sustained? Because do you have parents who are physicians as well? How did you sustain the vision? Because I thought I was going to be a veterinarian until I got into a squabble, and that was the end of it.
Okay. Well, for one thing, a lot of medical students stayed at our home, and 2 of them were my cousins.
Oh,
And
yes.
eventually, they became neurosurgeons. One was a neurosurgeon and one was a urologist.
Mhm.
And I looked up to them so that when I got into college, I really pursued biology in UP Diliman as a
Mhm.
pre-med course. And we had a heart-to-heart talk with my neurosurgeon cousin. He said,
Mhm.
sigurado ka ba dyan? If you are sure, then it's going to be a long trip, a long journey, and you have to pursue it to the best of your ability. Kasi being a doctor really is more diligence and perseverance talaga. So there, that's how I pursued the pre-med. And then, katulad ng sinabi mo, it's expensive. But, my mom, natagpuan niya ang pamantasan ng lungsod ng Maynila at the time when it was still a scholarship program that
Mhm.
was under the City of Manila government. So yon, since it's a scholarship program, our tuition was subsidized by the government.
Okay, so you are a scholar ng bayan for biology in UP, and then you are a scholar ng lungsod under pamantasan. But
Yes.
when your cousin said, "Are you sure about what you're getting? Do you know what you're getting into?" What exactly did you discover on that journey? Because tumambay naman ako dun sa mga bridge dyan sa Arts and Science, sa AS. And talagang many students, I remember, who were really dead set on becoming doctors or vets. I mean, they had their nose to their books and their notes, and they were constantly doing group studies, etc. But what did you discover? What really is the biggest challenge to becoming a doctor?
It's really finding out what you want to be and to do for the rest of your life. I think yun. Actually, I had some kind of a distraction at that time. I was into dance. I was very, very serious in my jazz dancing under Douglas Nieras at that time. And
Okay.
when it came to a point when I had to choose talaga, I said, pwede naman siguro akong dancing doctor. Mahirap yata yung dancer tapos magiging surgeon ka later. But in being a surgeon, pwede ka rin naman maging dancer. So I think that was a crossroads for me at that time. I really had to make a choice.
I mean, one is a passion, the other one is a calling. For the students nowadays, for for those who are, I mean, it's a legitimate conflict, a legitimate dilemma because some people will say, napaka-trivial naman maging professional jazz dancer. Hello, ano yan? But I know that there are people who've made careers and have become legends in the field of dance. Who stopped you? Kumbaga, sino nakialam?
Myself. I don't think I'll be a professional jazz dancer. It was just something that I really enjoyed doing.
Okay.
But being a surgeon talaga, I think that was really my calling.
Okay, now being a surgeon, okay, because there are doctors and there are surgeons. What's the difference?
Well,
In real, in real application. Kasi may mga kilala akong surgeon, wag na wag mong makanti yung kanilang daliri. They will not do menial work with their hands. Parang their eyes and their hands are an extension of their brains. They're so protective. But in your experience, what is the difference between being a doctor and a surgeon?
if you look at it, all across hospital leadership, no, you will always see a surgeon being at the forefront. And I think it's also important that you work well with your hands. Kasi it's not all, academics. You really have to be able to control your hands and know that once you use your hands, it results in a positive effect on a person, positive impact on a person. I think as a surgeon, makikita mo kagad yung result ng gawa mo eh. I think yun yung pinaka-importante doon. Unlike, for example, other fields where they prescribe medication, you will have to wait for a certain period of time before the effects will be manifested. But as a surgeon, pag may sugat, tinahi mo, kita mo kagad, there's immediate improvement. Or sumasakit ang tiyan, inoperahan mo, nawala yung sakit, nag-improve ang pasyente. It's almost immediate. I think yun yung gratification or satisfaction in being a surgeon.
Yeah, but there's the issue that you can heal and you can kill. Sabi nga ng mga pastor, I can marry you and I can bury you. But surgeons, you can heal or you can kill. When did you realize that you have the nerves to go through this on a daily grind?
Maybe during my rotation as a clinical clerk and as a postgraduate intern, because during that time you are given 12 months to rotate in all the different clinical departments. And I think that was a clincher for me because I saw that I was good at it and had a very positive review or feedback from my patients at that time. Okay.
And okay, so you become a surgeon. And most people leave it at that because not to be trite or anything, but surgeons do make a good living, and especially abroad. You could have lived abroad, you could have made a fortune and be happy. But parang you went even past that. You even became a public health executive. How did all of this happen?
Kanina, di ba you mentioned my education was subsidized by the government.
Yeah.
I think it was payback time. And so during residency, when I came to Rizal Medical Center as a general surgery resident, of course, as a surgeon, you want to go to a public hospital or a government hospital because you know that you need to have more cases so that you will be trained well.
In ordinary parlance, you need to go to the combat zone to become the best at being a surgeon.
Yes, yun. So aside from public service, which is, I think, as I said, it's about time that I give back to the government na nag-sustain ng aking education, it was also a good training ground for me. Now, after my training, I went for a short stint lang abroad for a clinical observership to a surgical oncology because that was my interest then.
Mhm.
There was a reason for me to come back to Rizal because there's a tumor clinic, a well-established tumor clinic and cancer registry. And I felt that that is where I can contribute more. So when I came to Rizal Medical Center as a consultant, it was more because I wanted to serve as a surgeon and in the field of cancer surgery. However, when I came, sina Dr. Sakilayan, our immediate past medical center chief, he was still the chief training officer at that time. He saw that I had some potential. And so he urged me, encouraged me, pushed me even to pursue master in hospital administration. So
Okay.
when I couldn't say no anymore, I enrolled in a program in the College of Public Health in UP for Master in Hospital Administration. And
Pareho pala tayo, no? Kailangan
yeah,
napipilitan.
yes. So, tinulak in other words.
Tinulak. Okay.
Tinulak.
Yeah, but Dr. Rica, why oncology? Because, okay, you said 7 years old, you wanted to be a neurosurgeon. Clearly, you became a surgeon, but am I correct? It was you were not a neurosurgeon, and then you went into oncology.
No. Through the years, somehow na fine-tune yun eh. There were several mentors who came alongside me, and I saw that it was something that I could be, I can contribute and I can participate. And so, yun, that's how nag-detour pa nga ako sa plastic and reconstructive surgery. And that's the reason why I went to Rizal, because at that time, Rizal Medical Center was one of the 4 hospitals in a consortium for plastic and reconstructive surgery outside of PGH. There were only 2 programs at that time. And so, doon ko lang nga na-discover ang Rizal Medical Center because one of my mentors pointed me to Rizal. So when I came to Rizal and then I was introduced to the different specialties, it was cancer surgery that was kind of most interesting for me.
Okay.
And, I just want to extend further. Later on, my sister, my only sister, developed breast cancer. And it was very important that I was also in the field. So I was able to help her in that.
Okay, but you weren't an oncologist, or you didn't have you didn't have extensive training in oncology at that time, right?
No, it was just a clinical observership in Memorial Sloan Kettering Cancer Center in New York City.
Okay, now, but what convinced you that, hey, half of my life is going to be dedicated to oncology? Because that's the impression I get. You've dedicated so much of your life now to making Rizal Medical Center a gold standard for hospitals, for ano ba yung tawag sa inyo, referral hospital ba yun?
Referral hospital.
Referral hospital. So, but was it that trauma with your sister that kind of got you, hey, this is serious, I gotta go here, oncology?
I think I got interested in cancer surgery even before my sister had cancer.
Okay.
And so it was a good exposure for me in my clinical observership, and also because my sister lived in the US. And so when I would go and sit with her and her doctors, my exposure or my training and experience helped me understand more and guide my sister in her decisions.
Okay. Please educate me, Doktora, because very simple yung aking mental process. When you say cancer surgery, tastasan, because if there's cancer, we take it out. Is that the beginning and the end of cancer surgery? Or what are the facets of cancer surgery?
Well, cancer surgery is only a part of the multidisciplinary treatment or management for patients with cancer. There are cancers that can be treated with just chemotherapy. There are cancers that can be treated with only radiation. But in most instances, there are certain cancers that you have to treat with a combination of different treatments, and cancer surgery is part of that.
Okay, now what is difficult for you as a practitioner in cancer surgery? Because I mean, most of the time, what I hear as far as surgeons go is that they have to cut something off. For women, it's usually ano bang tawag mo
Number
doon?
one ang breast.
Yeah,
Mastectomy.
mastectomy. For men, it's removal of the prostate, etc. What is the most difficult part of that process?
The most difficult part is sitting down with your patient and making them understand the diagnosis at first and the journey that they have to take. I think that is the crucial part in a surgeon's life, when you have to sit down and explain everything. Obviously, a diagnosis of cancer is like a death sentence for most patients, and they have to understand that early diagnosis and treatment results in better survival. So yun yung kailangan mong mapaintindi sa kanila. A lot of people obviously are scared of the cost of the treatment, and some would even go alternative, no, because they think baka wala na silang pag-asa, or hindi nila kakayanin. They have to sell their house or their fields or their house in order to do that. Pero ngayon, the government has already made provisions, marami ng tulong to answer for the cost of treatment. So ngayon, it's just the willingness really of the patient to undergo yung initially mag-opera, and then after that, some of them will require some chemotherapy, some would require radiation, which is a daily going to back and forth to the hospital for a certain period of time. And then after that, merong mga iinuming gamot for 5 to 10 years. Yun yung journey, kailangan they will be willing to take that journey. And it is the surgeon's role to make them understand that. The beauty of the current practice now, which is multidisciplinary, is we sit down not only with the patient, but with the family, and all the specialists will be there in that conference so that all of their concerns will be addressed.
Kumbaga, you have a team supporting you. Okay, Dr. Rica, let's go for a quick break, 1-minute break. When we come back, I'd like to talk now about Rizal Medical Center and your life as a medical director of the facility, the institution, and the challenges that one goes through running such hospital and that huge team of professionals. We'll be right back here on Agenda. Welcome back to the program agenda, and joining us is one of my favorite doctors representing one of my favorite hospitals, and hindi po ako nambobola because ever since things I mean, I don't know, ever since I've decided to support public hospitals, I've discovered how the Rizal Medical Center has evolved right before my eyes. Kasi nung nag-umpisa yan, parang ape, kawawa, and through the efforts of government and the leadership of RMC, it has transformed into a really nice hospital that is public. Dito, everyone is equal, and they have all the facilities. Dr. Rica Lumague. Doc Rica, welcome back.
Ay, syempre favorite ka rin naman namin.
I was actually surprised when you were talking about the oncology facility of the RMC. Parang ang dami ko pang hindi na di-discover din sa hospital, and maybe pasalamat na lang, no, that I don't need to discover it unless I start putting on a gown and start doing rounds pretending to be Dr. Beltran. But anyway, Doc Rica, what has it been like? What is the life of being chief of the Rizal Medical Center, or being a hospital director, so to speak? How different is it from just being a physician or a neurosurgeon or an oncologist?
Well, for one thing, I just want it said, no, that whatever improvements and development Rizal Medical Center has right now has to be started from way back. I only started as the medical center chief recently. So, yung immediate past medical center chief namin, si Dr. Relito Sakilayan, will have to take most of the credit. And also the entire team. And syempre, kasama ako dun sa team na yon because I was working alongside him as the chief of medical professional staff then. Now that I'm medical center chief, nakita ko it's really a different perspective. You not only look at the hospital and the services, you also look at the employees and how to support them, because the hospital will not function without our employees. And I'm proud to say that we have the best specialists. We have a very good team working with us. So, yon.
How did that happen, Doc Rica? Because you're correct. Much of credit goes to Lito Sakilayan, who we've also had on the show in the past. But how did RMC manage to attract the best and the brightest? Because my first encounter there was when wala pa si Doc Lito noon, napapabayaan pa yung public hospitals. And then my friend, Dr. Mike Sarte, casually mentioned, "Oh, bro, I'm doing consultancy at RMC." And we talked about the sleep lab. Sabi ko, teka, mukhang asensado na yung RMC. May sleep lab pa, may consultant na tiga Medical City or St. Luke's. How did the facility manage to attract private hospital consultants?
I would say first, because we have a residency training program and matched with the facilities where these specialists will be able to further improve or enhance their practice. Sometimes kasi it's not all about money. Sometimes it's really making an impact, being significant and contributing to nation building. A lot of our consultants, mind you, they really would like to be part of something greater than just, flourishing private practice. Kasi after some time, when your needs are already met, you want to go a little bit higher. Siyempre, Maslow's, di ba? So, we managed to attract these specialists because they can see that the top management has their support when they request for certain equipment, when they request for expansion of services. Of course, hindi naman namin yun mapoprovide agad-agad. But once we sit down with them and we discuss probably a 5-year plan and they see that, hey, may patutunguhan. Ibig sabihin, may mangyayari. So they see that their investment of time, their expertise, and their effort redound to something greater than just plain private practice.
Okay, but how does the hospital manage to set up clinics, facilities that are found in the big private hospitals? Because for the longest time, di ba, ang mentality is, well, public hospital yan, kadalasan dyan paanakan, nakagat ng aso, nasagasaan, nasaksak. But since I've been visiting your hospital, which is in my neighborhood, ladies and gentlemen, baka akala ninyo ito ay pa-press release. Hindi po, kapitbahay ko po yung RMC. But, you have a sleep lab. You have a very modern, impressive blood collection area, facility. You have a heart, ano bang tawag doon? Parang heart laboratory.
Heart station, diagnostic cardiovascular unit.
But how did RMC manage to get all of that set up given the contrarian mentality or mindset of people na public hospital yan, di naman natin kailangan gastusin yan?
I don't know if you've heard of the Health Facility Enhancement Program of the Department of Health. In the HFEP, meron kasing additional funding for equipment and infrastructure. Now, when there is additional funding, then we start thinking of how to expand services. And as I said, because we have a very good team, we sit down with our teams and we decide what would be priority. During the time of Dr. Sakilayan, there was a move of the Department of Health to identify certain hospitals as apex or end referral hospitals for certain specialties. And Rizal Medical Center was identified as an advanced brain and spine care, skin center for dermatology, eye center as well. Now, when we embarked on our performance governance system or PGS, of which you are part of our MSGC, we were able to focus our funding, focus our hiring and development and providing space for these specialties. So, it's a step-by-step, really careful planning so that we are able to focus our efforts on certain centers that eventually will provide what has been mandated by the DOH for Rizal Medical Center. And for the next 5 years.
Yeah, I remember a conversation I had with Dr. Sakilayan before. Sabi ko nga alam mo, napapaligiran kayo ng mga villages in our area. Many are senior citizens. Many have heart problems. And they all have to go to the heart center. And kawawa na yung heart center, malayo pa. So I think that was part of the discussion that Dr. Sakilayan pursued for putting up that heart facility. Now, how about you? What is on your screen or what is your target in terms of facility? If there's one facility that you believe has to be set up in Rizal Medical Center, what would it be?
Okay. I-connect ko lang muna yung sinabi mo about yung heart station or heart center, no? When before Dr. Sakilayan retired, merong cath lab, no? But the cath lab has very limited capability at the time because we did not have open heart surgery. And so I'm happy to share with you that on Valentine's Day, February 14 of 2022, we embarked on a courageous leap of faith. We opened an open heart surgery. We conducted our first open heart surgery so that magkaroon ng double setup so that we can expand the services of our cath lab. So ngayon, we are developing that, and since then, we have had 6 open heart surgeries, 4 of which are bypass procedures. And I'm also happy to say that one of those patients happened to be one of our employees, one of our our chief carpenter, and all of those were successful surgeries. Now, to answer your question, we did our strat planning, and we have identified certain centers that we will be developing. Some of them are mandated by DOH, as we have been identified to be a center of that. But on top of what DOH has mandated, we will develop a mental health center, a maternal health center, a neonatal health center, geriatric center, a toxicology center, a digestive center, and hopefully a stone center in the next 5 years.
Will you be developing these facilities on a satellite basis? Because napansin ko yan sa Pasig because of the limited spaces, particularly Rizal High. Merong Rizal High sa gitna ng Pasig City, may Rizal High doon sa Barrio Capitolio, between Capitol 8 and Barrio Capitolio. Sabi ko, dito lang ako nakakita ng puro extension services dahil walang lupa. What about Rizal Medical? Are you going to build up or will it be extension services or facilities?
To start, it's going to be just extension services. But if there's somebody who will provide space for us outside of our current location, calling all of those who merong mga a generous heart and with a space that you can donate or allow us to use, then that would be a great help to us when we expand our services.
Nako, umpisahan na natin ang prayer brigade dyan sa RMC at saka dito sa agenda for that miracle to happen, because that's how we started this morning, about making prayer your lifestyle so miracles can be your lifestyle as well. But anyway, going to the subject matter, what did you have to learn or train for or add on to your skill set in order to run facilities such as Rizal Medical Center?
Mentoring is very important. I received very good mentoring from Dr. Sakilayan and Dr. Arandia, even before Dr. Sakilayan. Mm-hmm. I also received training through the Civil Service Commission or Civil Service Institute. They offer managerial and supervisory courses for chief executives and managers of hospitals and other government agencies. And also, I think the beauty of the timing when I was in the taking my masteral in UP was that I was already part of the MANCOM at that time. And being able to learn the theoretical in school and coming to work, you're already able to apply it. That combination was essential in my development, I think.
So it is a system that Dr. Sakilayan, good morning, Doc Lito, and others, parang you grow your own. Because in the past, it has always been, ilagay nyo dyan yung bata ko, ilagay nyo dyan yung kamag-anak ko. But it seems that now you are growing. It's all about homegrown talent.
That's right. And very foremost sa amin yung succession planning, not only for the medical center chief position, but also in the other positions. In fact, one of the courses that I took in the Civil Service Institute is succession planning. And ano yan parang may dashboard yan. Ready now, ready later, and ready in X number of years. So we have that. We have made those plans already.
Okay, but in terms of the next 5 years, what would be the skill set required? Because parang nag-iiba na ngayon ang medicine and disease management. Parang teka, dati sipon ubo trangkaso lang Ngayon pandemic ang pinag-uusapan and crisis management. Because I remember at the peak of COVID-19, who would have imagined that ambulances would become hospital rooms? Speaking of which, balita ko may bago daw kayong mga ambulansya na specially equipped daw.
Yeah, oo. I'm very happy to say that during the pandemic, we were the recipient of several units, no? And recently, we have received types 1 and 2 ambulances from the Metro Manila Center for Health Development and the DOH through the HFEP respectively. These transport vehicles have helped us transport our patients more efficiently and safely as they are well equipped with the necessary equipment for specialized care.
Okay, so parang ito yung mga mas magaling pa dun sa mga ambulansya na mga first class na tumatakbo right now in Metro Manila.
Well, it's equivalent. It's standard siya. May defibrillator, may negative pressure, may monitoring equipment. Yun. So, very good.
Okay, now what are the challenges that you and the center or Rizal Medical Center face now? Because I don't think there is any public hospital that has without a need. Kumbaga, lahat nangangailangan. If it's not space, it's budget. As far as the RMC is concerned, I mean, if I miraculously become a billionaire, ibibili talaga kayo ng lupa. Pero
thank you.
Pero but what
I'm
does the yeah, okay, hey, anytime. But what does the RMC badly need at the moment?
Okay. With the easing of restrictions, public hospitals such as Rizal Medical Center are now deluged with backlog of non-COVID cases. That's including cancer patients, stroke, cardiovascular diseases, and the like. Of course, we still see patients with COVID, but only as incidental findings as they are being managed for other conditions like those who are giving birth. You know naman, the last quarter of every year is the peak of deliveries.
Yeah.
Another challenge is triaging COVID and non-COVID patients. We know that DOH already said that starting September, COVID will be considered as an endemic condition already. But, for the past month, since the supply of RT-PCR kits has been problematic, we have to find other sources. And because of that, the turnaround time for results have medyo matagal. So, the stay of the patients in the ER, whether, especially if they are symptomatic, medyo mahirap silang i-triage. So, that's another challenge. And telemedicine is also a challenge because of the issues of connectivity and of our patients and their willingness to pursue the procedure of getting an appointment. When it comes to, for equipment, marami kami niyan. We have a wish list, a long wish list. So, we have planned them year by year of the things that we need to acquire, and hopefully the government will be able to provide. Now, for those, we have also received donations from Rotary Club of Pasig, also part of our MSGC, and other benefactors. Marami kaming natanggap na mga equipment from other very, very generous public and private individuals. Yon. So, do I rattle off my wish list?
If you at least tell us your top 3 or top 5 if you wish.
Yeah. For one thing, very important sa amin yung provision of a more comfortable area for our patients and their client and their relatives. So I'm sure when the last time you came here, inikot mo yung OPD namin di ba? And then you saw na inikot mo, and of course you were impressed, di ba? Sabihin mo.
Yes, I was expecting to see a madhouse, something that was stereotypical of public hospitals. Pero sabi ko, teka, parang ako nasa private hospital dito
So anyway, nakita mo naman that the gang chairs that were being used by our patients, medyo some of them are dilapidated, some of them medyo hindi na in the best of that can be a way for others who will be interested.
Yung gang chairs, parang yung mga silya sa airport, correct?
Yes, correct.
Okay.
Correct. Yun.
Magkakano ba yan, Doktora Rica?
Mag-usap na tayo. Hindi ko memorized ang presyo.
Hanap tayo ng sabongerong nanalo sa derby.
Anyway, that's another. And if you look at the area where the waiting area for yung mga kamag-anak ba ng mga inpatients namin, medyo hindi rin siya komportable. So I don't know how that can, others who will be interested in helping can improve that. Meron din kaming, right now kasi, we are already expanding our electronic health records. So nakita mo naman, wala na kaming papers sa OPD namin. We're expanding it to the ER, and we are already in the process of procuring yung servers namin, yung computers, and then later on we will be expanding to our inpatients so that we will be a paperless system. So that's another venue for help in that sense. Kasi syempre the servers are really expensive, and we have already provided a space for expansion of our information technology. And also, yung sa human resource information system namin, we are also going into an integrated system wherein all of our human resource management transactions will all be using a software para integrated siya. So the recruitment, selection, and placement, the performance management, and rewards and recognition, as well as learning and development, are all integrated into that system. So we're working on that.
Well, we seem to have made it to the finish line on time. But Dr. Rica Lumague, thank you very much for your time, and allow me to say thank you. Greet the entire staff of the Rizal Medical Center for always having welcoming arms, not just to me but to the residents of Pasig, Rizal area. And also, mga kaibigan, yan pong RMC, referral center yan, all the way for patients, all the way coming from here in the Calabar Zone area. So marami, they serve so many Filipinos, and we should continue to pray for them. And if you have the means, please, tumulong naman kayo kaysa sa ipusta nyo lahat yan sa sabong. Medyo pumusta naman kayo sa ospital. Okay, Dr. Rica, thank you very much, and have a good day.
You too, and I would like to thank Gab, the one who oriented me this morning. Thank you for
our EP.
And of course, Johanna, for the gracious coordination. Cito, you have a dynamic team, and congratulations to your show. More power, and God bless you.
Thank you very much, Dr. Rica. And that's it. Let's now go to our blessing for the week. And it is from the book of Deuteronomy. It is a blessing for our country. It's a prayer that, or a declaration we must declare for the Philippines. It's from Deuteronomy 11, verse 12. It is a land the Lord your God cares for. The eyes of the Lord your God are continually on it from the beginning of the year to its end. And we have come to the end of our program for today. Hoping to see you tomorrow. God bless, and please keep it here on One News.